Welcome to our first ever Leaders in Lockdown debate. It's almost a year since the first lockdown was introduced, and we're hopefully going to see restrictions start to ease soon. Today we're asking, what will life be like in the coming year, but also what have we learned and what things have changed? It's also been a great chance for our listeners to submit questions. So I'm joined by David Fothergill, the leader of Somerset County Council, and also our Public Health Director, Trudy Grant. So let's go to our first question. The early days of the pandemic saw a huge rise in people on push bikes. Now, what is being done locally to ensure people continue to cycle?
So during the first lockdown, it showed us that there's a huge appetite for people to cycle if the conditions are right. The low traffic made people feel safe to cycle, even on main roads with children. And it demonstrated that we need to make the road environment better for people to cycle more, not just rely on encouraging people to cycle. So in Taunton, Bridgewater and Yeovil in particular, we've been working really closely with cycle user groups to develop local cycling infrastructure plans, which will help us to invest funds wisely where they'll achieve the most in terms of increasing cycling. There are going to be new cycle tracks which will be constructed this year.
OK, well, thank you very much for that. The next question, what work is taking place for those who've sadly lost their jobs during the pandemic to help them to find new jobs locally and obviously well-paid, what they may consider to be good quality jobs?
I think sadly that the impact on employment hasn't really been seen to any great extent yet. The situation in the county, I think, is we're in a bit of a false period where people have been supported through furlough schemes and through business support schemes, and sadly, I think as we come through the pandemic over the next few months, that the amount of unemployment is likely to rise, and those that are impacted by it is likely to rise. So this is a critical point for us. We've got some very large employers, of course, that have already announced that they'll be scaling back, and I'm thinking in the child area in particular, and we've worked very closely with large organisations down there to help to redeploy some of their staff. But across the county, the important thing is that we move on to the economic recovery, and as part of that we look at the skills mix that's needed. So a lot of work is going into how we can start to retrain people, how we can start to give them new skills, how we can start to open up new job opportunities. And I think this is the major work that we really need to do over the next few months. And as the furlough scheme begins to fall away, and as those business supports begin to fall away, and businesses go through that economic recovery period, I don't think any of us are quite sure of the scale of the impact that's coming down the tracks, but certainly a lot of work is already in place, and we're already focusing on the future and how we can help to retrain and how we can help to redeploy people into roles where we do know there'll be much greater demand.
Well, this summer, we're certainly expecting a huge rise in staycations, certainly here in the West Country. Do you feel that could affect local COVID infection levels?
In essence, it's hard to tell. We've got last summer to go by. So our COVID rates last summer were very low in the county, and we didn't actually see any major impact from visitors. There were a few small outbreaks, but actually we brought them under control quite quickly. Environmental health colleagues are already working with tourism businesses in our county to make sure they can operate in a COVID secure manner this summer. And I think it's really important to point out that there's still a proportion of the population, whether they're both residents and visitors actually, that at this point in time aren't yet vaccinated. Some not vaccinated at all, some might just have one dose of the vaccine. And I think it's really important to stress that we all need to keep following the guidance. It's not necessarily just visitors into our county that need to follow the guidance. It's absolutely all of us. And we need to remember that having the vaccine is not a free pass to drop our guard. So we need to, whether we're customers or business operators or people coming into the county, we all need to stick to the infection control messages around hands, face, space, and open the windows on a regular basis.
One question lots of people have been asking what is being done to ease congestion in Somerset as we go forward. Will we see our usual traffic jams on many of our A roads throughout this summer? Do you feel, as a result of maybe something that's changed during the pandemic, things are starting to change in this regard?
So I think we have to answer this question in two different ways. I think we have to talk about local traffic, and I think we have to talk about national traffic. There's no doubt that people have shifted away from public transport. You've only got to look at our bus systems and our trains, and you'll see that people feel much safer in their car alternative. And I think that unfortunately means that there will be more car journeys, and most of the car journeys locally are less than 2 miles. So what we've got to keep doing is working to get people out of their cars. There's no reason why they shouldn't be walking more, why they shouldn't be cycling more. We need to make it easier. We need to make it encourage people to do it. And we need to do whatever we can to build the confidence that we get them back on that public transport. So there's a lot of work to do here. And I think a lot of behaviours have changed locally that we'll need to, we'll need to go back, and we need to really try to influence the way that people are moving around our towns and our villages. I think in terms of the national picture, I'm sorry to say that I think that the summer is probably going to be quite busy on our roads. The M5, the 303, the major roads coming down to the coast. I think we've already seen that people are going to struggle to book holidays abroad, but people will still want to take holidays. So I expect that travel to Cornwall and Devon and to our own coastal areas and to our own tourist areas will become really busy. I don't think there's any way around that. We've done a lot of work in terms of Junction 25 and in Yeovil and up in Bridgewater, trying to improve our traffic system. But I think we have to be honest that people are going to stay in the UK this year, more likely than not, and therefore the amount of traffic that's coming to the West Country in the summer, and therefore the amount of traffic jams that we're going to see, I fear, are probably going to be worse than we have in previous years. Just need to be patient. We need to get people back onto public transport, but we need to be prepared, I think, for quite a difficult summer in terms of journeys.
Over the past year, more and more people have been working from home. Do you feel Somerset's broadband has coped particularly well? Is this an area we're looking to address in the future?
Well, that's a really good question, Andrew. And I think we've all sat at home, and I know Trudy struggled a bit even this morning. So we've all struggled with the broadband, and the only thing I would say to people before I answer the question is we could not have done what we're doing now if it had been 10 years ago. 10 years ago, we were still using dial-up. We were having speed below one meg. It was just unbelievable. And we could not have done all the working from home and all the transactions that we've done. We couldn't have done all the online shopping that we've done, and certainly the home deliveries. So we in many ways, our technology has really supported us through this pandemic. But it's also shown our weaknesses as well, and particularly in some of the in the rural areas. Although actually some of the rural areas equally have some of the best internet. So it is an area that we need to focus on, and you'll know that, or your listeners will know that we have Connecting Devon and Somerset, which is our delivery vehicle for getting funding to areas which are not going to be commercially served. And that Connecting Devon and Somerset Phase 2, as we call it, has just been awarded to four major providers across the county, and they'll be working over the course of the next 2 or 3 years to improve full fibre to premises and to improve broadband speeds. But I suspect this is just one of those areas where people are going to expect more and more and more. And the important things that we keep investing in it. This is technology for the next 10, 20, 30 years. And of course, we can't stand still. We need that investment, and we will keep delivering it through Connecting Devon and Somerset.
OK, well, thank you very much. Now, probably another question for David, which is quite a tricky one to answer. What's your short and medium term hopes for the economy of Somerset? Do you feel the recovery will be quite mixed across the county? And what support is the council able to offer, do you think?
I think going forward, the economy is going to be our big challenge. I'm quite positive. I think that people will bounce back, and I think that people will want to get out there, and I think that people will want to spend. And I think what we'll see is a very short-term bounce. My concern is the sort of medium term, because I think once people come through that and they've gone back out and they've done a bit of shopping and they've been to their favourite restaurants or the pubs, and then I don't know how much behaviours have changed, and in the medium term over the next 2-3 years, how much actually that has reduced spend in the county, and therefore I think there is a real concern. So my hope is that as we get people back out and they get back out spending, and we see the economy begin to recover as we will through this summer, that we can see that crystallise and that gain continue into the medium term. In terms of the support that we can give, you'll know there's various business grants and various business support that is offered, particularly through the district councils. We're working on a number of additional bids through our economic recovery programme, which has been submitted to the government, where all 5 councils are working together. So there is support, but the important thing is that businesses actually see the opportunities which are going to be opening up for them, trying to maximise those opportunities. There is a need to start to move the commercial model that some have operated under, and I think we've seen that during the pandemic. But I think what we're going to see is quite a shift in people's behaviour, and therefore we're going to have to see a shift in the way that businesses deliver their services as well. So it's going to be a really interesting and unfortunately quite a challenging time for many, I think.
Thank you, David. Now, a question for Trudy. One we had a couple of people asking, what support going forward is likely to be offered to those who've struggled with their mental health, and both adults and children, that is?
So the support that's needed through a pandemic is very varied, as you will imagine. There are obviously needed to be support for physical health during the pandemic, but the health of emotional health and well-being of people has really suffered during this period of time. Some people have coped very well. Some people have really struggled with the lockdowns, in particular this last one. So from a children and young people's perspective, there are 3 aspects of the support that we've been offering and will continue to offer going forward into the future. The first one is around support to parents. We've been working really closely with our educational psychology service, who've provided some very specific support via a helpline and messaging services for families. Young Somerset, one of our local voluntary sector organisations, has been offering virtual hubs for parents as well, which will continue to go on forward through the future. And there's lots and lots of information which we've been providing through the Parent Carer Toolkit. Public health nurses have been using Chat Health as a way of messaging parents, and that will continue going forward. Then we've also been supporting our schools as well, and the school staff play a really significant role, safe and trusting adults really, that can help to identify early signs of distress and seek further support So we've been working a lot with our schools. We've provided lots of training, psychological first aid training for staff in schools, and obviously the benefits of that have been seen through the pandemic, but also will continue as we come out of it. There's a helpline for staff if they're worried about children and young people's mental health, for example. And there's lots and lots of resources that we've been developing, bite-sized video clips, training sessions, all sorts of things around mental health first aid and emotion coaching. And the last bit for children and young people in particular is actually support for the children and young people themselves. So we've been working very closely with our mental health support teams who've been providing support via education mental health practitioners, offering one-to-one and group support for children and young people with mild to moderate mental health problems, and they could be referred through school or primary care for that. Young Somerset also have been doing some great work on one-to-one based community and support groups, which can be self-referral through schools. And also we've got the online counselling service, Kooth, which provides a really good and a modern way of supporting young people, particularly those aged between 11 and 19. Again, the public health nursing service using Chat Health has been helping people of between ages of 11 and 19 as well. And one of the really important things, if we're moving on to the adults support that we've been providing, one of the really important things is Mindline. And the Mindline work has just been amazing. It was set up in the first 4 weeks of the pandemic. And it's a real team effort across our county for providing this. So it's been funded from the County Council, the CCG and Somerset Foundation Trust. It's open to anybody, adults, parents, young people. And during the time, Mindline have had over 25,000 calls across the county. And that's a service that was up and running before the pandemic, but it really has, we've increased the capacity of it hugely. And Mind have done a fantastic job working with other colleagues on that as well. So there's a whole host of different support which is out there. That support will continue to be provided going forward. One of the other things which has been really great actually is we've really increased our opportunity for bereavement support in the county, which, as you can imagine, through a pandemic, many of us have sadly lost loved ones, and it's been a really important part of the work that we've done through the pandemic is to make sure that the bereavement support is there, and that's managed largely through Marie Curie and Mind, and will continue going forward for as long as people need.
Well, thank you very much for that, Trudy. Probably the last question to your good self. When will we expect the population of Somerset to be vaccinated? What is the current timescale you're working to? How are we doing at the moment?
So we're doing a fantastic job on the vaccination in this county. The NHS, working with the County Council and working with a whole variety of organisations. It's a huge programme, as you can imagine, the biggest vaccination programme that certainly we've ever known in our lifetime. So we are aiming to have all people in the county over the age of 50 offered their vaccine by the end of April, which I'm delighted about. So I haven't had mine yet, so I'm looking forward to that. The overall aim is for people in Somerset over the age of 18 to have all been offered a vaccine by the 31st of July, and that's the national timescale. But actually, Somerset is well on course to achieve that. Hopefully, fingers crossed, it all goes well. But we're definitely on course at the moment. I think one of the things I would like to point out is that if you have been offered a vaccine, please take it up. It's the route out of this pandemic. And it's really important that going forward, we continue to protect ourselves, but we all protect each other by having our vaccine. And just lastly, Andrew, if I may, can I just say, if you have had 1 dose or even 2 doses of your vaccine, at the moment you must carry on with the good infection control practices. You must carry on with the hands, face, space. At the moment, we know the evidence shows us that the vaccine is good at protecting us from the disease. What we don't know yet, quite until the research catches up, is how good the vaccine is at preventing us passing the virus on to others who might not yet have been vaccinated. So it's really important that even if you've had 1 or 2 doses or no doses at all, you keep up with those infection control behaviours.
Well, thank you both very much for your time. I've learnt a great deal from those questions there, and we'll put a link in the article below, but it's important to say lots of information is available on the County Council's website in terms of coronavirus, in terms of advice, and of course the support that's available. As discussed, there's a link in the article below. Thank you very much for watching.